Good evening. My name is Dr. Vijay Rao. I am a rheumatologist working currently in Manipal Hospital, Bangalore. The diagnosis of ankylosing spondylitis is not based on one particular test, either a blood test or imaging. It's a combination of history taking, examination, blood tests, and X-rays or MRIs. So how do we diagnose ankylosing spondylitis? The diagnosis is based on two arms. We divide that into a genetic testing arm or an imaging arm. In an imaging arm, we need any of the following features plus an X-ray or an MRI evidence of ankylosing spondylitis. So what are the features? We call that spondyloarthropathy features. So must is a back pain, which is back pain in young, less than 45 years, lasting more than 3 months, and worse in the mornings with stiffness and responding to non-steroidal drugs. Also, any of the other features which I mentioned now, such as anthracites like Achilles tendon pain, heel pain, then pain in the ribs, then pain in the joints such as knee joints, ankle joints, hip joints, along with swelling in these joints, and psoriasis, then uveitis, inflammatory bowel disease, family history of ankylosing spondylitis, family history of psoriasis, raised inflammatory markers such as ESRCRP, and negative history for any other back pain. So if any of these features are present along with an X-ray evidence showing grade 2 to 4 psychrolutes bilaterally, or an MRI evidence of showing psychrolute bone edema called osteitis, then that suggests that that patient has ankylosing spondylitis. Now the genetic arm, if the HLA B27 gene is positive, along with two or more of the any features which I described of spondyloarthropathy features, then they can also have spondyloarthropathy even if the X-ray and MRI is normal. So in a sense, the genetic test helps in picking patients earlier, but genetic test is not a diagnostic or a confirmatory test, which most people have got the wrong information, because even if the HLA B27 is normal, the patient can still have ankylosing spondylitis. The other misconception is that the inflammatory markers such as ESR and CRP is normal and hence the patient doesn't have ankylosing spondylitis, which is totally wrong, because ankylosing spondylitis patients, only 30 to 40% of them will have raised inflammatory markers. So diagnosis is by combination of history taking, that is establishing the nature of inflammatory back pain, by doing inflammatory markers tests such as ESRCRP, by doing gene tests such as HLA B27, and by doing imaging tests such as X-ray or MRI.